be advised, the opinions and views of the hosts and guests do not reflect those of the station.
Magandang umaga sa inyo lahat at muli isang oras tayo rito sa Usapang Kalusugan. Ako ay si Vic Chua, yung host for today. Ang ating kaibigan si Brother Ramon ay hindi makapagpunta rito. Kaya for the meantime, ako muna. And we hope that we can answer and bring you quite a lot of information. And today, our topic will be on the mga kababaihan, ang mga sakit ng kababaihan. And as we are going to go forth, alam mo, there are many things to discuss in this area of concern. From usually ang sinasabi natin ay yung mga sakit ng kababaihan ay from the menstruation period, yung kanilang PMS, yung kanilang mga ovarian problem, mga fallopian tube, mga cervical problem, even in pagkatuloy natin, even to the extent of yung menopausal, premenopausal and postmenopausal problem. Ngunit meron din mga concern na ang tanong maganda, may tatanungin natin sa ating guest kung bakit kaya ang mga bata, dati ang alam natin ay normally it's around 12 to 14 years, 14 to 16 bago sila ng may menstruation. Pero ngayon, narinig natin na nagkakaroon sila ng menstruation mga bata na 10-year-old, 12-year-old. No? Or even narinig ko during our last PICA meeting na meron narinig namin na at 6 and 7 years old nagkaka-menstruation na. Later on, we will now try to ask our guests na subukan tayo at pwede niyong i-text sa amin ang inyong questions and inquiry tungkol sa iyong concern. At ngayon, ang gusto natin makita, perhaps, no, na ang ating lifestyle here, even to the extent of before ang bata ay nag-conceptualize, the mother plays a very important role sa pag-develop and preparing herself towards itong stage na to concept and even to bring up itong nasa womb niya into a certain stage of bata ay magkakaroon ng well-developed and healthy child. God has created the woman to have that kind of ability, in many forms, not only to carry and sustain, but also to bring about a healthy child. Then today, we are going to understand what are the different tips and what are the different concerns upang ang isang magulang or magulang-to-be could be able to achieve ang kanyang role in preparing this child to be. As we are going to wait for our guests na late dahil sa na traffic, we will now go further to the different areas of concern in the area of ating feminine problem. And perhaps we will understand that the lifestyle is very important. Anong kinakain mo is very important. The introduction of different phytoestrogen compared to synthetic estrogen is very important. The way that the whole system of the body in detoxifying all of those harmful hormone is also very important. I'll give you an example. God created our body, the women, to produce a hormone called estrogen. Estrogen is actually being used up in the body. Ngunit, pag ang estrogen ay tapos ang kanyang papel sa ating katawan, no? God created that liver, the phase 1 and phase 2 of the liver, to detoxify itong tinatawag na estrogen na tinatawag na estradiol na harmful to the body into estrone. Still phase 2, it will further degrade into estriol. Ang estriol ang safe. So therefore, pag oras na halimbawa nakikita natin sa mga babae during yung during his menopause, no? Narinig natin na the girls usually have some kind of a lump. And then this lump tendency is to, after menstruation, it will go and dissipate. Now, when we have a poor liver function or detoxification, this estradiol, which is the harmful side of the estrogen, no, will now bring about into a harmful product called even to the extent of estrone. No? So therefore, anong dapat nating gawin? We should be careful of taking yung mga food that will help the liver to detoxify. And what are the different naturopathic doctors are doing? They are introducing yung kanyang sinasabi nila ng broccoli. Nag-introduce sila ng mga cabbage because of the indole C-carbinol that excites the liver to be able to detoxify into harmless estriol. Remember, ang estrone, ang harmful side is the estradiol. From estradiol, the phase 1 will now convert it into estrone, and then the estrone will further be converted into phase 2 called estriol, which is the harmless. Kaya kung halimbawa hindi natin na-detoxify itong mga ito, what will happen? Then it will now bring about mga problema from fibroids to even later on cancer. However, ang sinasabi natin na itong mga problema nito is also caused by even human papillovirus, which brings about yung cervical problem. So later on, dahan-dahan lang, we'll go to the different areas of interest, especially for women, no? And habang hinintay natin si doktora ating guest, no? We will go now to perhaps yung mga questions that is text to us. Ito, from 0919-7078-794. Masama po ba kung bata ka pa na nag-menstruate? Ang ibig sabihin po, pag maaga kang magme-menstruate, maaga ka rin magme-menopause. Alam mo, whenever a certain, it's a early stage of maturity, no? Hindi naman sinasabi na madali ka maaring menopausal syndrome is actually in the latter age wherein our body mayroon tayong sinasabi na halimbawa, bakit 40 years old nang may menopausal na? Hindi ba? So it is actually the body's system to bring about parang ibig sabihin na natuluyan na, napaaga. What are the causes of all of this? It is because of your lifestyle. Anong kinakain mo? Anong dahilan na nagkaroon ka ng mga problema, nagkaroon ka ng halimbawa, hindi matupad ang pangangailangan ng katawan? And usually, when we say yung sinasabi na menopausal syndrome, no, sinasabi yung mga hot flashes, yung mga iba-ibang mga menopausal problem. Usually, ang sinasabi namin ay it is actually the body claiming yung kakulangan mo when you were young. And because you didn't support your body, now, the body now, at a later age, now claims and brings about yung mga menopausal, postmenopausal syndrome. Okay, so later on, we'll go back and perhaps our guest doctora could give us a more better idea on yung tinatawag mo na early related to early menopausal. Here is another one from 0919-7078-794. Okay po bang kumain ng soya at tofu kung may ovarian cyst ka? Tofu and soya have a phytoestrogen. Itong phytoestrogen, ito ay nakakatulong sa lalo lang sa mga nag-menopausal, no? Because actually, this will now support yung kakulangan ng production ng estrogen. Remember, when you have a menopause, that means to say, no, that means to say na ang katawan mo ay kulang sa pag-produce ng estrogen. So therefore, if you have this phytoestrogen to support, it will now bring about a continuing demand, support to the demand of your body. So soya and tofu are actually, later on, we will flash it on our Kalusugan tips, no? Ang mga tips for women in the menopausal stage. Okay? So let's go for another one, 0916-736-1553. I heard na kapag nagpa-hormonal therapy, ay prone ka sa cancer. Pag nagka-edad ka na, ang pag-treat po ba ng polycystic ovarian syndrome using contraceptive pills constitute hormonal therapy. Does it mean prone ako sa cancer or mas mataas ang risk? Let's take it one at a time. Una-una, you should remember that taking contraceptive, you are withholding the body's ability to produce by itself yung estrogen. So therefore, can you flash it back? Isa-isa natin yung tanong na ating kaibigan. Remember, polycystic cancer, polycystic ovarian syndrome, no, or polycystic, is ang ovary mo ay full of mga cysts. Itong cysts na ito are more of the causes of inflammation. Kaya, pag oras na halimbawa ikaw ay nagkaroon ng polycystic ovarian syndrome, no, let's say halimbawa treatment, no, the best thing is to take quite a lot of natural anti-inflammatory food. Example is, maganda ang mga mushroom. Mushroom are found to be a very good anti-inflammatory food. And the best thing that I would say ay ang anti-inflammatory ay yung tinatawag na yung granada. Ang sinasabi ng sa granada, sa English naman, ang tinatawag niyon ay ang tawag nun? Yung nakikita natin, wala na tayo nakikita sa ating kaligid, ay yung itong sinasabi nating granada. No? But it has a very powerful anti-inflammatory because it has what you call quercetin. Ito isang anti-inflammatory. Not only that, it's a powerful antioxidant. No? Now, let's go now to the next thing. Contraceptive pill constitute hormonal therapy. Contraceptive pills is withholding, holding back yung estrogen. No? Does it mean to prone ako sa cancer? Remember, the common saying that hormonal therapy, you have to be careful with that because it will lead now to a risk factor in contracting cancer. sasabihin natin na not only contraceptive pills, but even the food that you take, which are high in synthetic estrogen, no? Lalo na yung mga pesticides and insecticides in our food. So you have to wash them properly, no? So that in other words, hindi tayo magkaroon ng problema sa ating kalusugan. Okay, so we have another text message. Okay, now I want to show you one thing, no? Itong sinasabi nating madalas na sinasabi natin na mga herb. Okay? Do you know that cinnamon, yung cinnamon na nabibili natin, was actually a very traditional Chinese medicine? You know, when I was small, I saw my father, yung kanyang yung cinnamon na yon, bark. Tapos ang ginagawa niya, china-chop-chop niya, slice them very thinly. And then afterwards, in-steam niya, and brew them. It's actually good for not only, nalaman na later on, na it is actually quite a lot of benefit for the reproductive system of the individual, the lady. Ngunit, ito naman, bakit siya ay nagiging magandang advantage to the reproductive ability of the individual? First and foremost, it now improves the body stagnation. Siyempre, pag oras na halimbawa, stagnant ang blood mo, siyempre, there are many complications and many other problems. No? And not only that, it now brings about and stimulate the production of your hormone. It relieves dysmenorrhea and also yung mga clotty period. Ang kaganda nito, it stimulate the uterine and result to a lighter period. So remember, itong cinnamon na sinasabi natin, madalas nakikita natin na cinnamon ay nasa cinnamon cake and all of this. It plays a very important role in our health, no? Even to the extent of what? Decrease the period pain and clotty period. Decrease the blood viscosity. Of course, when the blood is not viscous, no? Siyempre, maganda ang pagkakalakad ng circulation, and then even the discharge will be not hindered. Now, it also reduces total cholesterol and the LDL cholesterol. It prevents progression of arteriosclerosis. Wow! So, even yung mga hindi mga even in the area of hindi babae ang pinag-usapan ng kanilang concern, even to our all general concern, the stagnant blood will bring about acidic blood. The acidic blood will cause so many problems, even to the accumulations of free radicals, or even thriving of all of these mga opportunistic bacteria. So therefore, if you have a very good circulation in your system, no, definitely it will really help the body restore back to normal. And that is actually naturopathic medicine, being able to help the individual restore the body back to its original form, so that in other words, it will function what God has sustained it to be. Remember, we have God who is a perfect God. He created that body with all of the mechanism, with all of the system, to be able to function properly, so that you will live, as in Genesis sinasabi nila, your gene is designed to live for 120 years. Let's go for another text. From 0926-1344-819. Ano pong pagkain ang maganda dapat kainin para magkaanak? That's a very tall question. definitely, you should remember that the imbalance of the lady, imbalance of your hormone brings about a control and inability for you to be able to conceptualize. Sa lalaki naman, pag oras na halimbawa may problema ka sa diabetes o kaya sa prostate, then there are so many complications. No? And so, ang tanong, ano bang dapat kainin? Well, let me tell you this. Your lifestyle is important. Prevent acid-producing food. Of course, you should remember likewise that if you have an acidic body, then many complications come forth. No? Now, let's go for another one from 0927-900-2370. Good AM. Ask ko po kung saan magmumula ang sakit ng myoma ng babae. Myoma is actually a benign. Ito ay nagfo-form sa ating sa babae, no? Ang tinatawag niya uterine fibroid o myoma. Now, what is uterine fibroid? Ito ang magandang pag-usapan natin. Ang uterine fibroid it's a benign, hindi naman cancerous noon. Ngunit ito ay katulad ng mga breast cancer, no? And even ovarian cysts, yung mga tinatawag na fibrocystic breast problem, no? And endometriosis. These are all fibroids which are influenced by the high level of estrogen level. Fibroids, according to doctors, called myoma, are not cancerous mass of muscle and connective tissue in the uterus and do not spread. It may cause no symptom or many symptoms. Growth leads to ranges of symptoms depending on the position and extent of the pressure. Alam mo, madalas tayong narinig na yung myoma nito ay napapa-opera. Pero tandaan mo ito, in 1987 and 1986, ang Blue Cross dyan sa Illinois ay gumawa sila ng isang study. Nakita nila, ang dami palang, nakita nila, there are more than 1/3 of the hysterectomy performed ay unnecessary, hindi pala dapat. No? So, high level, ang sabi nila ay, bakit kaya? Because actually, agad-agad gusto nila tanggalin. No? But there are many ways of dealing with that. Pero first, katulad kanina sinasabi natin, no? High level of estradiol from estrogen can stimulate the breast and uterine tissue growth and worsening the estrogen-dependent problem like fibroids. Now, to keep up with, para bring down the estrogen level, all you have to do is consider the fruits that you eat. The vegetables, the grain, the beans, the raw seeds, and nuts. These are all makakatulong sa pagkakano ng formation of fibroids. Avoiding high-stress foods such as meat, dairy products, alcohol, and sugar, which overwork the liver. Remember, the liver is the one that neutralizes the harmful estradiol into estriol. No? Because in the same way, the liver function should actually be considered. No? Now, if you have a good liver function, definitely wala kang dapat alalahanin. No? Now, using plant estrogen called phytoestrogen, like the bioflavonoids, which act also as an anti-inflammatory, and extremely important in reducing inflammation associated with the fibroids. So, we have answered what you want, especially on the myoma, which we have heard left and right na ang babae, yun ang kanilang major concern. We will pause for a break, and then we'll come back with more of your text questions, as well as be able to answer most of your concern.